Now at 6, cautiously hopeful. The new signs that social distancing is slowing the spread of COVID-19.
The curve is flattening, but this is no time to spike any footballs.
But the battle is far from over. The new strategies to keep people safe and inside their homes.
And could your pets now be at risk? The new concerns for pet owners after a confirmed case at the Bronx Zoo, a tiger. Good evening, I'm Chuck Scarborough reporting from home.
And I'm Natalie Pascarella, also from home tonight. Just moments ago, Governor Andrew Cuomo says that President Trump has granted permission for the USNS Comfort to accept COVID-19 patients. The naval ship originally was just for non-COVID overflow patients. He also announced the statewide pause order has now been extended through April 29th. Non-essential businesses and schools will stay closed until then. The maximum fine for violating social distancing protocol has now doubled to $1,000. The governor said that distancing does appear to be working, but that does not mean that everyone is abiding by this. Just take a second and look at your screen. Here in just the past hour, Chopper 4 spotted dozens of people playing soccer, working out there in Victory Field. It's in Forest Park, Queens. They definitely were not staying 6 feet apart. Now in New York, cases keep rising, but the rate luckily has slowed. Governor Cuomo says cases are essentially flat for 2 days, meaning the apex could be near or at the rate that it's leveled off for now. Hospitalizations are down. Intensive care admissions are as well. Across the tri-state, almost 131,000 cases in New York. 4,758 deaths. In New Jersey, more than 41,000 cases. Your number at 1,003 deaths right now. More than 6,900 cases in Connecticut with 206 deaths. News 4's Andrew Sifkin kicking off our team coverage live at Bellevue Hospital with the latest, Andrew, on the city's efforts.
Right, Natalie, and keep this in mind. If New York City and New York State is at the apex or peak, it could be a plateau, meaning it could last for days or even weeks, and that puts tremendous pressure on the hospital system and also the medical examiner's office. You see behind that green fence there's a makeshift morgue. There are dozens of them around the city. More on that in a moment. But the mayor with a positive note today saying that some of those personal protective gear shortages have been solved, at least for now.
I just want to thank you.
Mayor de Blasio in Brooklyn today, thanking workers for making gowns, helping stem the shortage of personal protective gear.
Our public hospital system has enough for this week.
But in Harlem, nurses marched and chanted.
Every day, every week.
Upset they've been asked to reuse surgical masks.
Many of my colleagues, including residents, fellows, and attendings, have been exposed.
The emotional protest on the first day of what's expected to be the state's toughest week yet. New York may have finally hit the apex for new coronavirus cases.
Well, the numbers look like they may be turning. Yay, it's over. No, it's not.
The governor, far from celebratory, criticizing New Yorkers for going outdoors in large numbers.
If it's not about your life, you don't have the right to risk someone else's life.
One city councilman tweeted a frightening scenario: temporary internment, where the city might use a park for burials, trenches dug for 10 caskets in a line. Councilmember Mark Levine said another possibility is mass burials on the remote Hart Island.
I don't want to alarm people with that image, but I do think it's important people understand how the city will deal with a shortage of freezer space.
Meanwhile, the mayor ended the pilot program of letting New Yorkers walk on a handful of city streets. They reopened to cars today, while another makeshift hospital, this one in Van Cortlandt Park, is taking shape. This as brick and mortar hospitals approach capacity.
It's not that we're drowning, it's that we're just constantly treading water.
One more welcome development, the Mount Sinai Health System notifying employees today that starting tomorrow, anyone, even with mild symptoms who works at the hospital, can get tested. Until now, they had to display severe symptoms, frustrating and worrying many of those who have to work on the front lines. We're live in Kips Bay. Andrew Siff, News 4 New York.
All right, Andrew, thank you very much. Late this afternoon, Governor Phil Murphy announced New Jersey patients can now be treated at the USNS Comfort docked on the west side of Manhattan. This comes as New Jersey opened its first field hospital at the Meadowlands today to treat non-COVID patients. And some encouraging news in the Garden State. The growth rate of cases appears to be slowing there from 24% day over day to just over 12% today. But the number of deaths from COVID in New Jersey has now topped 1,000. News 4's Gus Rosendale is live in Secaucus with the very latest for us. Gus?
Well, Chuck, as you say, the first hospital of its kind in the state. We were here throughout the day. We saw staff and supplies arrive. Also arriving, as you touch upon, hope that maybe not all of this will be necessary. EKG machines rolling into New Jersey's first field hospital. Medical and military personnel are turning this Secaucus Convention Hall into a medical facility that will help during the coronavirus pandemic. But nurse Patricia Cruz says common sense remains key.
Keep your hands clean, social distancing, exactly what you're being told. Don't panic. It's not necessary to panic.
The 250 beds here are not intended for COVID-19 patients. Instead, they're meant to help with overflow from different types of cases overwhelming packed hospitals across the state. Similar sites are planned for Edison and Atlantic City. But all the extra beds may not be needed. Governor Phil Murphy says the growth rate of new cases is starting to slow.
This means that our efforts to flatten the curve are starting, and I say starting, to pay off, even with the lag time in getting testing results back from the labs.
Print my whole name.
Mike Filchek has been delivering medical supplies like these EKG machines across the country. Now he's in the epicenter of the crisis, where even with signs of hope, no one is slowing down on the front line.
New clients calling from all over the place. So demand is there, but there's shortages in equipment. There's only so much that our market could bear.
And then there is another kind of equipment. Governor Murphy told us today the state now has access to 20 refrigerated trucks that could handle a total of more than 1,600 bodies. And so, yes, there's hope out there tonight. That's also a very strong reminder of the tough days and weeks that are still ahead. We're live in Secaucus. I'm Gus Rosendale, News 4 New York.
Gus, thank you. Police in New Jersey are out in full force, cracking down on those who do not keep their distance. Last week, Newark police issued 824 summonses to people who violated social distancing rules. 44 non-essential businesses were shut down, but no drivers were ticketed. Newark, along with neighboring cities East Orange, and Irvington, have all been on lockdown since March 31st. Well, the number of COVID-19 cases is on the rise in Connecticut tonight. Governor Ned Lamont announced that 1,200 new cases and 17 new deaths happened. That brings the number of cases to more than 6,900, with 206 deaths in the state. The governor is already looking ahead to the coming months and ways to keep the public safe.
How can we thoughtfully get people back to work without having another wave of infections? And a lot of that's going to be in and around more broad-based testing.
And today, Governor Lamont launched a new public service announcement campaign, just reminding Connecticut residents to stay home, Chuck.
The New York City Parks Department has announced that all dog runs are going to close. This follows complaints of overcrowding in the parks there and dog runs. However, parks will stay open. The Bronx Zoo is dealing with a case of human-to-animal transmission of COVID-19. Officials now say the virus jumped from an employee to a tiger. And this has pet owners worried if they can now somehow infect their own pets. News source Mark Santia is in Valhalla with what experts have to say after this disturbing development.
One more time.
During this time of social distancing and staying at home, taking your pet outside has truly been a breath of fresh air. But now there's concern. A Bronx Zoo tiger sick with COVID-19. 4-year-old Nadia testing positive after developing a cough. The zoo believes an asymptomatic employee infected the animal.
Because New York City is in the middle of, this COVID pandemic and we're the epicenter for the U.S., it was logical to wonder and worry whether she could have been infected too.
6 other cats showing symptoms, all expected to recover. Outside the Bronx Zoo, the usually boisterous dog runs across the city are silent, now off limits.
I understand why they have to do it, but it doesn't make me happy.
In Tuckahoe, Tom Ringwald heard about the tiger's diagnosis. It has him wondering about his precious dog, Lola.
I was worried, should I not pet anybody else's dog, and should I keep my dog away from other dogs?
From what we know, no domestic animals, no dogs or cats in the United States have contracted the disease.
Dr. Kerry Rosen and the Yonkers team here at the Animal Specialty Center are taking care of pets during the pandemic.
We are just saying if you are sick or showing symptoms or tested positive, to please wear precautions around your pets. So gloves, face mask, wash your hands.
There are no known cases of pets infecting people with the virus. Dr. Rosen is reminding pet owners to practice social distancing, something Tom Ringwald is already doing.
So we'll stay away from other dogs and do the best we can like we're doing.
Dr. Rosen stresses if your pet has any symptoms, make sure you call your vet first. Don't just show up at the office. In Valhalla, I'm Mark Santia, News 4 New York.